because rural healthcare is really interesting to me. And the challenge is geography, obviously. There's a significant land mass that you have to get to the far reaches of North Carolina. Um, but you talked about education and how different communities have different levels of understanding. There's access to food and various things that we know deliver actual health to the community. It really almost requires an academic medical center, somebody like UNC that can bring resources from a lot of different perspectives. What's the biggest challenge around rural healthcare today? Really also focusing on an IT perspective.
Yeah, I think there's a couple of different things that come to mind, Bill. I think first and foremost is, and I suspect this would resonate with our peer organizations, physician recruitment in rural areas is really tough. So making sure that we've got the right providers and care teams in place to provide the care that's needed in the rural parts of the state.
So the natural thing is to say, well, why don't you just use telehealth? But that presents its own set of challenges.
So that's a perfect segue. I've heard on your podcast, which I'm an avid listener, and you do a great service to our industry with what you're doing here, and really appreciate all that you're doing, Bill. But I've heard recently people talking about the digital divide, and that is something that is real for us in North Carolina. Our governor's office recently just announced some really exciting initiatives and funding support to help us try to do that. I think that is, as much as anything, probably going to be in the next 3 to 5 years, the biggest inhibitor to really taking advantage of telehealth or virtual care in our vernacular, taking advantage of it to support the rural parts of the state. People just don't have the bandwidth access. I've heard others on your podcast here talk about, I've heard you, I think, recently talk about challenges right now in terms of network connectivity and a quality connection between the provider and the patient. And that's in more urban areas where there's higher grade bandwidth access. So when you really get to the rural parts of the state, that is even a bigger problem. And so I think we, especially with what we're focused on and the effort in North Carolina, it's something I'm personally very interested in, is what we can do to help close that digital divide and partner with government nonprofit agencies to figure out how we can bring more bandwidth to the rural parts of the state. I think that could be a game changer for rural health if we could really take full advantage of telemedicine and all of the advancements we've made in that space, as well as remote patient monitoring, and bring those capabilities to our rural patients.